Good morning, one and all presenting here. Today we're going to have a health talk on World Parkinson Day. So regarding that, I'm going to call upon Dr. Professor Prabhakaran for giving a speech on World Parkinson Day. Welcome you, sir.
Thank you, Dr. Thiru. Myself, Dr. Prabhakaran from JSS inys, Assistant Professor. I thank Lord Almighty and His Holiness and our Principal and our management for giving this opportunity to have a talk on World's Parkinson Disease Day. So today is World Parkinson Disease Day, and as you know, Parkinson is a neurodegenerative disorder. So kindly we are going to see about what are some consequences, why we are going to celebrate the Parkinson Day, and what is the cause, and everything we are going to see today. Can we slide change over? So, if you see about the Parkinson's Day, it is celebrated every year on April 11th. So, it first started on 1997, from 1997 by the European Parkinson Disease Association, which started this day. So, World Parkinson Day started by the European Parkinson Disease Association from 1997 onwards. So, why it is chosen on April 11th, if you see, means it was James Parkinson, the English surgeon, who had written an essay on shaking palsy during 1817, and it was first he mentioned about the disease, about the Parkinson, the technical term which he used in that was paralysis agitans. So it was used by him. And later, if you see the history of Parkinson, it was said in Ayurveda as Kampavada, which is it as a water-related disorder which affects the nervous system and all the flows. So Vata is associated with all the joint mobility and everything, as it is a air and ether related element. So it affects the mobility and all circulation like that. So Galen in AD 170, he said about the shaking palsy. And 1817, the description of symptoms was mentioned by James Parkinson in his essay on shaking palsy. That word he said about the paralysis agitant. And in 1862, the term was the term Parkinson was coined by Jean Martin Charcot, who was a pathologist, well-known pathologist, and also the inspiration, or we can say as a teacher for Sigmund Freud, who is the father of psychoanalysis. And 1919, degeneration of substantia nigra was later said, and by Fred Jauko. And in 1968, a large-scale result of treatment with L-DOPA had been considered, done by Porgias, and in 1979, MPTP induced Parkinson, Davis et al., Langston was done, and PARK1 gene in 1997 was discovered by and Polymorpholus. Next. So, in short, about English surgeon James Parkinson was born on April 11th, and this day is celebrated as Parkinson Day, and it was recognized by the English European Parkinson Disease Association in England. So he was the first one to describe the name as paralysis agitans. A condition was after him, it was named as Parkinson disease. And he had written this in his most important work as essay on the shaking palsy. Next. So the day was founded, and it was organized by European Parkinson Disease Association since 1997. Next. So the purpose is to raise awareness, support research, and to celebrate the community. So the celebrate this day is not only an awareness; it is beyond the awareness. So the Parkinson Disease Day is celebrated every year. So to initiate global movement to shine on light and challenges faced by these Parkinson's patient and the family, and opportunity to share knowledge and encourage early diagnosis and highlight the importance of research and treatment advancement. So the goal is not to raise awareness, but to inspire people to take action by learning about the disease and supporting the ongoing research, or offering assistance to their loved ones, make a difference in their life. Next. So the fact, if we see Parkinson Day, its a symbol is given as red tulip flower by the European Association, Parkinson Association, and purple is the color associated with the Parkinson disease. They had used the red tulip because everyone is using the ribbon. So purple ribbon is already used by the dementia and Alzheimer's. So in fact, they are changed and made it as a red tulip for the symbol of Parkinson disease. So now we are going to see about the Parkinson disease in general, and then we will go for the management of Parkinson disease. It is a progressive degenerative neurological disorders that affects the nerve system and also often impairs the motor skill, speech, and other functions of the patient who is affected of Parkinson. So Parkinson is a type of movement disorder that affects the ability to perform common and daily activities, like they will have some difficulty in going for the toilet and getting up from the bed mobility, and for sitting and standing. So they would have some slow process in it. And Parkinson is a slowly progressive degeneration of dopaminergic neurons within the substantia nigra that can lead to altered motor movements. As Parkinson is an extrapyramidal system affected disease. It is also characterized by tremor, rigidity, and akinesia and postural instability. It also can lead to non-motor symptoms like depression, anxiety, fatigue, and sleeping issues. Next. So epidemiology, if you see the epidemiology, India is also a leading hub for the Parkinson disease. And Parkinson disease affects 1% of the population over 65 years and rising to 2% at the age of or above 80. So 1 in 20 patient is however diagnosed before the 40th year. The age can be between 22 to 49. There are some persons who are also affected of Parkinson without knowingly. So majorly it is an elderly problem, a kind of, we can say, a neurodegenerative disorder like dementia, Alzheimer's. Parkinson is also a kind of neurodegenerative disease which affects mainly the old age, but it can be also affect up to 5% in young ages, adult from 22 to 49. Anyone can be affected of it, or we can generally say up to 64. So most epidemiological studies have indicated male has a dominance than female in the risk factor of the Parkinson disease. The prevalence of these disease conditions is approximately 5 per 1 lakh, and drug-induced Parkinsonism is a common form of so-called systematic Parkinsonism. So it affects 10 to 15% of the individual exposed to dopamine receptor blocking agents, and it also includes neuroleptics and some liberating sedatives. So it is also a drug-induced cases also can be found, but the actual cause is not known until now, and there is no proper or proper treatment also for this Parkinsonism. Next. So if you see the etiology, there is no proper cause. So apart from that, there is some of the causes like different cases. We can say a primary Parkinson disease, idiopathic. So this is by paralysis agitans. It is also called as paralysis agitans. Then the cause is unknown and treatment may be palliative and disease is incurable. Most patients suffer from this type of Parkinson. So hypothesis of neuronal loss in idiopathic Parkinson due to absorption of highly potent neurotoxins and exposure to more of free radicals. Then genetic factors also plays a major role, such as alpha-synuclein and Parkin are further being studied in treatment and diagnosis of Parkinson disease. Next. So secondary Parkinson, it's a known cause and only a percentage of cases are secondary and many of these are curable. So secondary Parkinson is caused by drug including dopamine and antagonists such as phenothiazine and epinephrine and butorphenones and poisoning by chemical or toxins, mainly because by carbon monoxide poisoning, heavy metal poisoning, and MPTP, a commercial compound used in organic synthesis and found in an illegal merpidine analog. Next. So infectious causes includes encephalitis and syphilis, and other causes includes atherosclerosis and degenerative disease of the central nervous system, such as progressive supranuclear palsy and metabolic disorders such as Wilson disease, which affects the liver. Next. So drug-induced Parkinson. So the most differential diagnosis to consider when a patient present with Parkinsonism is whether the symptoms and signs can be drug-induced. So drug-induced Parkinsonism is potentially reversible upon cessation of the offending agents. So drug-induced Parkinsonism with neuroleptic chlorozamine was first published in 1950. Then Parkinson is more common in elderly and in women. Then withdrawal of the offending agents will lead to improvement and resolution of symptoms and signs in approximately 80% of the patient within 8 weeks of discontinuation. Next. So coming to pathophysiology, Parkinson disease, as already know, it's an extrapyramidal system of the brain involving the basal ganglia. The extrapyramidal is also involved in maintaining posture and muscle tone and with regulating voluntary smooth motor activity. For reasons not understood, melanin-containing cells with the substantia nigra are lost in Parkinson disease. The part compact of substantia nigra in the midbrain is particularly affected. So dopaminergic neurons within the nucleus project to the striatum, and which is therefore deprived of the neurotransmitter dopamine. And Parkinson disease, there is a loss of over 80% of nigral neurons before the symptoms appears. Next. So in short, pathophysiology, the degeneration of the dopamine producing neurons in substantia nigra of the midbrain, and it disrupts the normal balance between dopamine and acetylcholine in the basal ganglia, in which dopamine is reduced and acetylcholine is increased in the cells. This impaired the extrapyramidal tract controlling and loss of motor control, which caused the tremor, rigidity, and echinacea. The Barak hypothesis has been proposed to found for the spread of pathology within the Parkinson brain and suggests that alpha-synuclein, which first accumulate in the lower brainstem and then gradually ascend rostrally to affect the critical brain regions, including substantia nigra and ultimately the cerebral cortex. So dopaminergic neurons are not only cells to die within the brainstem, and a plethora of other nuclear and neurotransmitter system are also involved. So cholinergic within the pedonucleoprotein nucleus degenerate and provides the potential clinical pathological and correlates with postural instability. So swallowing difficulty and sleep disturbance are also held due to this cholinergic neurons. Then the involvement of this nucleus in Parkinson disease may explain by dopaminergic therapy in relative ineffective in treatment and these particular clinical problems. Next. So within the striatum, there is also alpha aminobutyric acid containing neurons, which is also a non-physiological dopaminergic and which also as consequence of neurological dopaminergic deficiency. In Parkinson's disease, dopamine is progressively lost in nigrostrial tract and acetylcholine is increased relatively. Next. So next is about on pathologic examination in postmortem basal ganglia, the presence of Lewy bodies can be found, which is a protein accumulation, are noted within the remaining dopaminergic cells of the substantia nigra. So the presence of Lewy body is considered the pathogenic for the disease. So oxidative stress and excitotoxicity and neuroinflammation affects the upregulation and misfolding of the alpha synuclein, and also genetic mutations and predisposing polymorphisms also affects. Then it also transfers to cell transfer and also lysosomal and proteasomal functions, and which cause the cell death. Next. So clinical features, if we see the clinical features, bradykinesia, hypokinesia, apnesia, then resting tremors and others like reduced blink rate, then tiny writing, then pill rolling hand movements. Then there is also in the resting, pill rolling hand movements will be a major thing, and generally slowness will be there in the body, and static walk, there will be a subluxation gait, then reduced voluntary movement and delay in initiating the movements. So non-motor system symptoms you can see in CNS, dementia will be there, cognitive and psychiatric and sleep disorders, so depression, anxiety, psychosis, then insomnia and taste, visual and olfactory disturbances, then autonomic related with gastrointestinal dysphagia, constipation, nausea, vomiting, then weight loss will be there, then urgency, frequency, then CVS, there will be orthostatic and hypotension, then excessive sweating and salivation will be there, and also greasy skin fall, hair fall, and there will be normal falls and fatigue will be there. Next. So tremors, it is evident at most cases during resting tremor is probably the most seen, and with low frequency movement. When the thumb and forefinger is like involved in like a pill rolling tremor, like pills in those days in the early before the machines are there, they used to roll the pills in their hands. So like that the movement will be there. So it is mostly present at the rest and diminishes while the slight movements with the movements, and limb rigidity will be there. It is called cog wheeling. So it detects clinically when the arm responds with a ratchet like, and movement with the limb is moved passively. So almost expressionless and stooped posture will be there, and stiffness will be there, and akinesia and bradykinesia is performing common voluntary movements including standing, walking, eating, writing, and talking, like routine movements or things, activities will be affected. Next. So gait. So the patient will have a stooped and flexed posture, a short shuffling stride will be there, shuffling gait will be there, and diminished arm swinging in rhythm with the legs, and there will be tendency to accelerate or precipitate. And changes in mental status like depression, mostly 50% will be have depression, dementia around 25%, and psychosis are associated with the disease and may be precipitated or worsened by the drugs. Then tremors in the legs will be there, and legs, elbows, and wrist, back rigidity. Then there will be also, they will have a hunchback like posture, you can say kyphosis, and forward tilt or trunk will be there. In some cases, scoliosis may also affect, and the patient's expression will be like a masked face. Everything, the face will be seen like the same thing, there will be no emotion. So it is a spontaneous emotional response. There will no any spontaneous emotional response will be there. There will be a fixed expression in the face. Next. The symptoms, motor impairments like bradykinesia, hypersalivation, postal imbalance, tremor, stumble, and muscular rigidity, walking difficulty, and freezing of movements will be there. Then here non-motor impairment, pain, sweat, olfactory disorders, anxiety, depression, mood disturbances, sleeping disorders, cognitive impairment, and gastrointestinal issues. Next. So next is about how to find the before diagnosing about the finding about the Unified Parkinson Disease Rating Scale. So this is the scale to evaluate the clinical efficacy of anti-Parkinson drugs and monitor the disease progression. So the disadvantage is with the use of scales for the rating of the functional and motor disabilities of the patient with Parkinson. So it includes the potential of interactor variability and impression because of the semi-quantitative scoring. So actually, it is scored by the person without anything what he offers. Then the result of testing depends highly on the stage of disease, whether the patient is being evaluated during or on or off the period. So part one of the UPDRS is elevation of menstruation behavior and mental strength, behavior, and mood. And part two will be self-reported evaluation of the activities like daily living or how he is doing his daily activities of daily livings. That includes speech, swallowing, handwriting, ability to cut food, dressing, hygiene, falling, salivating, and turning in the bed. That is bed mobility and walking. Next. So part three, it is about clinician scored monitor evaluation. Patients are evaluated for the speech and breast tremor, facial expression, and mobility. So the tremors of hand, rigidity, finger taps, and hand movements, and rapid alternative pronation and supination, movement of hands, and leg agility. And each of these are things evaluated on the scale of 0 to 4. So a rating of 0 on the motor performance evaluation indicates normal performance, and rating of 4 on the motor performance evaluation scales indicates severely impaired performance. And part 4 will be the Hohen-Yahar staging of severity of Parkinson disease, which is of 5 stages and scored from 1 to 5. And in addition, now it is being upgraded with 0 to 5 with adding of 1.5 and 2.5 to the scale. And part 5 will be the SWAB and England ADL scale about the activities of daily living. Next. So this is the staging of disability that is measured by the Hohen and Yahar scale. So stage 0 will be the no signs of disease, and stage 1 will be one-sided symptoms of one-sided like tremors and akinesia or dyskinesia will be there. Then stage 1.5 symptoms are unilateral and also involve the neck and spine, and stages 2 symptoms on both the sides, but there is no impairment of balance. Then stage 2.5, so mild bilateral symptoms with recovery when the full test is given. So the doctor stands behind the person and asks them to maintain the balance when pulled backwards. So stage 3, balance impairment, mild to moderate disease, physically independent, and stage 4, severe disability, but still able to walk or stand unassisted with some difficulties, and pain will be more in this stage. And stage 5, needing a wheelchair or bedridden unless assisted. Next. So these scoring will be made by the attenders or the doctors who are attending. Then the stage next will be the SWAB and England activities of daily living scale. So it is about the percent of rating. It is about how they are depending. So the patients, attender, or helpers, or the relatives, or the doctors will certify them. So 100% is about the completely independent, and 90% is about completely independent, beginning to be aware of difficulty, and 80% completely independent, conscious of difficulty and slowness, and 70 not completely independent, 60 some dependency is needed, and 50 more dependent, 40 very dependent, and 30% much help needed, and 20% severe invalid, and 10% complete invalid, and 0 will be the vegetative function and bedridden. Next. So diagnosis, it depends upon the clinical findings. So tests are often used to rule out the origin of secondary Parkinson disease. New technologies like positron emission tomography PET scan are used to visualize dopamine uptake in the substantia nigra and basal ganglia. So the measures PET scan measures the extent of neuronal loss in these areas. And single photon emission computed tomography can be helpful for diagnosing Parkinsonism syndromes and non-Parkinsonism syndromes. So other investigation diagnostic tools like transcranial ultrasound examine the fits in olfaction, then detection of oligometric alpha synuclein in blood of the patients. Next. The positron emission tomography, that is PET scan of the brain, showing the difference in fluorodopa level between those of with and without the Parkinson disease. Next, the pharmacological treatment. So anti-Parkinson drugs like dopamine suppressors and dopaminergic agonist and COMT indicators, central anticholinergic and antihistaminics, then peripheral decarbylase inhibitors, then MAOB inhibitors, then glutamate and antagonist dopamine facilitators are given. Next. So next we are going to see about the management of Parkinson through naturopathy and yoga. So first of all, we have to understand the condition of the disease, how the disease is classified or known to naturopathy and yoga. So in naturopathy, if we see the primary cause of disease, everything is violation of nature's law. So violating the nature's law gives us three important side effects, or the primary effects or primary manifestation. So these primary manifestation includes low vitality, then about abnormal composition of blood and lymph, and at last accumulation of morbid matters. So basically, if you see about the Parkinson disease, it is mainly of low vitality. So it is mainly we can say about the nerve cause. So nerve is really degenerated and it is called innervation, that is nerve fatigue. So now nerve system is affected and it is a degenerative process is going on. So it is due to the low vitality. It may be a cause according to naturopathy, which may be overstraining, over emotional, over doing overworks and having some unkind what we can say harmful drugs or any medication or surgery which can affect the nervous system, and also some habits which affects the health, like smoking, drinking, and also some other kind of drugs or tobacco can be used, can be affected. Next. So yoga, it is also related with adhijya vyadhi, that is internal imbalance. So why it is adhijya vyadhi? There is another type called anidya vyadhi. It is also due to some kind of you can say communicable and infection. Through infection also it can be affected. So moreover, it is classified in adhijya vyadhi due to the internal balance. So it is due to mainly of degenerative in the nervous system. So it is mainly affecting the nervous system. So it comes under adhijya vyadhi, which is also mainly due to the koshas, pancha koshas, is affecting the pancha koshas also. Dhanamaya kosha, prana kosha, manomaya kosha, and annamaya kosha, manomaya kosha, and pranamaya kosha. Next. So yoga therapy, if we see yoga therapy, we can make the patient in a tailored form of yoga, like chair yoga can be given, or we can ask them to do small exercise if they can stand or if they can sit. There are some yoga asanas we can add up. So first we can ask them to practice from sitting in a chair, and slowly we can make them to sit in the ground or in the in the standing position and supine position and prone position, we can add the asanas. So slowly we can start with the Pawnam Muscle series 1 and then slowly to the some asanas like uh, Tadasana, then Bhujangasana, supine and prone we can also add slowly like Uttanpadasana, then also we can add some more asanas, which also gives some uh, flexibility, and we can also add these asanas. And pranayama, if we see Nadi Shodhanas, Chandra Vedana, Brahmari, and Shitali, Shitkari can be given. Then meditations, Omkara chanting, then A, U, M chanting. Separately, we can say Omkara chanting. Then we can also give IRT and QRT. Then we can also slowly teach them Surya Namaskar in the future also. So yoga enhances the dopamine release by reducing stress and lowers the cortisol. So improving the nigrostriatal function, and also in PD where dopaminergic neurons are degenerate. Next. So yoga promotes gray matter volume and increases in the prefrontal cortex and also hippocampus and basal ganglia and the regions affected by Parkinson's disease. And holistic modulation of neurotransmitters, neuroplasticity, and stress pathway offers a promising agent. And it also improves balance, gait, and rigidity via basal ganglia plasticity. So many studies have gone through, and it is one of the studies that had shown that yoga participants have shown quantitative improvements in shoulder and hand movement, alignment, and also have baseline postural analysis. So the posture can also be improved from being in a kyphosis as kyphotic, like a kyphotic posture they maintain. So muscle tension and everything will be relaxed, muscle rigidity will be relaxed by doing the yoga. Next, by meditation and pranayama, it increases the serotonin and GABA, then counteracting the Parkinson-related depression and anxiety. So it makes them free from stress and anxiety and depression, and also balance the nervous system and calms the mind and reduces the tremors. And meditation may increase melatonin, improving self-disturbed in Parkinson. Next. So sleep is also increased while doing yoga, and there is a good improvement in their quality of life. Then hydrotherapy, if you see hydrotherapy treatments like neutral spinal bath, which gives relaxation and tonification to the spinal, then cold hip bath, then ice massage to the heads, then immersion bath, and we can also do steam bath 1 or twice in a month or week. We can give once in a week also. So it enhances the blood circulation and reduces the edema and stiffness, the condition, and it also stimulates the proprioception, that is the awareness of the body, and helping with the balance. So muscle relaxation is also improved, reduce spasticity and rigidity. So pain relief is there. So does the arthritic joints common in Parkinson's disease, and water provides gentle resistance and strengthening the muscles without the strain. So it counteracts bradykinesia, slowness of the movement. So in hydrotherapy, along the pool therapy is also there, which is with the physio or the fitness consultants. So balneotherapy, a kind of thing which can strengthen the muscles. It is also good. So muscle relaxation, and that's also helps the balance. Next. So massage therapy. Next is about massage therapy. So full body massage or partial massage, and mainly to the spine, head is given. So partial massage to spine and head also increases the improvement, and it also increases the blood flow to stiff muscle and reduce hypertonicity, then break down facial adhesion, then stimulates parasympathetic nervous system and lowers the stress hormone and boosts dopamine. So there are many case evidence, and it is also, there is a study which is significant in rigidity and bradykinesia. The 4 weeks of Swedish massage, which shows a significant reduction in rigidity and bradykinesia, and the trial was also given myofascial release improve the gait speed and postures in the Parkinson disease patient. Next. Next. Mud therapy. So mud therapy, full body mud therapy, full body mud is given, mud bath, and also local application can be given to the joints which has more stiffness and pain. So it improves blood circulation and reduces the muscle stiffness and applying, and also for edema condition it reduces. Then it stimulates parasympathetic response and promotes relaxation. So magnesium and sulfur are major in mud, and selenium zinc is also found in mud. So it is help to relax muscles and reduce tremors. And zinc and selenium having an antioxidant effect, potentially protect the neurons. And mud pack reduce pro-inflammatory cytokines. And it also helps in joint pain and stiffness, which is common in Parkinson's disease. So it reduces the joint pain and stiffness. Next. So acupuncture. Acupuncture is also majorly trained for the dopamine regulation, anti-inflammatory and antioxidant effects, and neuroprotection, and it also reduces the pain and everything. So it stimulates dopaminergic neurons in substantia nigra, and it also increases the brain-deprived neurotrophic factor and supporting the neurons survival. So reduces alpha-synuclein aggregation and lowers pro-inflammatory cytokines and mitochondrial functions and cerebral blood flow. Next. So plantain leaf bath and chromotherapy. So plantain leaf bath, it is also a good in relieving, and it also improves the relaxation. It gives a good relaxation. It improves the, it acts as a neuroprotective agent. Epigallocatechin gallate, which is a major component, a phenol component seen in plantain leaf and green tea. It has a high potential neuroprotective agent for Parkinson's disease due to antioxidant and anti-inflammatory, and also helps in ion chelating properties. So, plantain leaf bath, the EGCG, which is also act as a levodopa, and it also helps in the producing of the dopaminergic in the neurons in the brain cells. Then green and yellow charged water can be given and used to treat for depression, and red and orange charged oil can be used to given for the massage. Next. So nutrition, if we see the nutrition side, patients, there are some conditions. So increased risk of poor nutrition and weight loss will be seen in the patient due to the slow eating and not able to digest, or the couldn't do some activities even in the difficulty in swallowing. So sufficient fiber and fluid intake help to prevent the constipation associated with Parkinson's disease. Then calcium supplementation helps to maintain the existing bone structure. Then excessive dietary proteins in the later stage of the disease causes erratic response to the levodopa. Then a large body of literature supports the pathology. Next, products such as alpha tropopol, R-vitamin, and creatine, and coenzyme Q10 and scavengers of free radicals, which are harmful to the cells. So the main role of antioxidant is to reduce the scavengers, that is the free radicals. And antioxidant rich foods like berries, green tea, turmeric, nuts, that is high in vitamin E, can be given. And mainly green tea is having the EGCG, epigallocatechin gallate, which is also polyphenol, and it also works as an antioxidant, anti-inflammatory, and is also for potential neuroprotective agent. Mediterranean diet is also used like olive oils, fish, leafy greens, and slows the motor decline. Ketogenic diet is used as ketone protects the dopamine neurons. So intermittent fasting can delay aging. If the patient is not of any comorbidity, intermittent fasting can also done. It is also used for the young adults who want to protect them from these neuro conditions. They can also do intermittent aging, intermittent fasting as it delays the aging, and take more of ketogenic diet and Mediterranean diet. Then probiotics, which improves the constipation and motor symptoms. Then avoid processed foods and excess iron and dairy and excess protein diet. So Parkinson's, about the exercise, so Parkinson UK has said that an exercise regime will improve the following. So walking, sitting down, standing up and turning in bed, keeping joints flexible and relieving the effects of rigidity, then improving or maintaining muscle strengthening, then balance training and preventing or managing falls, pain relief through manual therapy, then maintaining or improving effective breathing. Like that we can do. Then it is also said that physiotherapy gives a major effect in the patients. We can help them practicing how to stand, how to sit, how to maintain the posture, and for free from then to teach them about the strengthening it with assisting and resisting exercise can be teach. So that, and there is also a thing called peg, which is help for them, like keeping the thing in this is a kind of occupational training. So it helps them to maintain and the flexibility and improve their flexibility and also muscle strength, and for using the small helps in using them. And we can also help them by wearing clothes which is having which is free of buttons, and also which helps them for not holding or like that. So free dresses. Then we can also train them about how to turn the side and turning in the bed and also everything. So these kind of exercises are taught with the help of the physiotherapist. And so this is our hospital, a 150-bed hospital. So we treat every cases, not only Parkinson, we also treat all the kind of disease. Mainly it is not only for the patients, it is also for the health seekers who want to be disease free. You can come and get admission in our hospital. So this is our admission hospital contact number. You can find and located it. So it is in Palakkad Highway and Coimbatore, and you can come there and have see a green revolutionized, a green surroundings in the hospital, and you can have a learning about how to maintain your health. You can learn. It is like educating yourself to keep yourself healthy, because health is the wellness you can achieve. So thank you once again for listening, a patient kindness listening this day. So you can have an awareness about the Parkinson disease, and you can not only, it is not going to, you can protect yourself and you can also help others who are affected. This day is celebrated as an awareness program, so that people can motivate and also take action to help the Parkinson patients who are affected. It can be a relative or a friend or a family member. And thank you once again. Thank you.
Thank you, sir, sharing your inputs to us. It's a really wonderful session. So thank you. Thank you all. So we'll meet with other topic. Thank you.
Stama,